Welcome back. Prostate cancer. It's the most common cancer among men, second only to skin cancer. Now, today on Colorado and Company, we're focused on getting over that stigma of men's issues after prostate cancer treatment and getting to what is really important, men's health. Now, Boston Scientific and the Urology Associates have teamed up to help men live fuller lives and more satisfying lives, and we're thrilled to have them on the show today. Now, one quick little note, if you do have kids in the room, this is going to be a clinical talk, so it may be a good time to take them on a little walk or maybe get them a snack. So with more on this topic this morning is Dr. Michael Davenport from Urology Associates. Good morning. Thank you for being here today.
Thank you for having me.
You know, my family, we have a lot of men who are really focused on prostate issues right now. Hopefully it doesn't turn into anything more serious, but this is a big issue. And after men go through their prostate cancer treatment, there can be some side effects that are tough to deal with. So let's start with that conversation.
Yeah, and so I think that it was important to bring up that that statistic you brought up earlier. And there's never a good time to have cancer, but right now there's been so much good research and science around prostate cancer that the treatment is really successful, and most men either manage or treat the disease well. But what we haven't focused on a lot, I think, is what it means to live past cancer.
Right.
And that's a lot of what I spend my time talking about with patients. What's the emotional toll that cancer takes? What are the financial problems that have to treating cancer? Specifically for prostate cancer, there's some sexual side effects, problems with erections.
Right.
There can be urinary problems. People develop scar tissue where they can't pee at the site of surgery, or they have the opposite issue where they're leaking so much that they can't control it. And so that's most of what I spend my day talking about.
Well, like you said, it's a quality of life thing. So the embarrassment or you don't want to run into your doctor and just put all these things out there on the table, but the fact is we've got to get more real about the conversation, because dealing with incontinence for a large portion of your life after cancer treatment would be so tough. So does everybody suffer from that issue?
So not everybody, thankfully. We've gotten really good about managing the treatment side of it. And so now what we think is we expect about somewhere between 10 and 15% of men to have leakage that lasts after prostate cancer treatment. I personally think the number's a little bit higher, mostly because a lot of men are tough and they don't want to bring it up. They don't want to talk about it. And those are the guys that I worry about, people who are sitting at home and are keeping it to themselves and don't feel like they have a space where they can talk about these issues.
Yeah, exactly. Remember, you are not alone. This is a common problem. Like you said, 10 to 15%, that's a big percentage dealing with those types of issues that could change how you operate in your life in general. So
exactly.
What about some of the treatment options? What are we dealing with here for a man who's coming in and really saying, I'm ready to have this conversation and start a process?
Sure. So the first treatment option is one that's probably well known to a lot of the women in the audience, Kegel exercises that strengthen our pelvic floor and try and give us a little bit more control of urination. And then the next thing is where most men stop, and that's the coping mechanisms, wearing pads, wearing diapers, and just sort of going through life.
Yeah.
And really, I think that that's a bad way to approach it, and I want people to know that there are other ways to treat it. And so if the exercises aren't working to build up the muscles that we need to control things, then we have surgical treatment options that can really help restore continence and get men dry again.
Well, that is good to hear that there are options out there. Now, these are long-term options that can solve a problem for the rest of a man's life, right?
Potentially for the rest of their life,
right.
And the surgery is a one-time experience that then kind of gives you many years of being dry again.
Okay. Now, we want to talk about something specifically called the male sling from Boston Scientific, and you've teamed up now, and you're going to tell us a little bit about those details.
Sure. So the male sling is called the Advance XP, and what it really is a hammock. And it sits, it gets put underneath the urethra, and it gives the urethra some support and a boost. And it lifts it up, and it moves it back into the pelvis in a position where it can keep the urine from leaking out of the bladder more effectively. And so it's a simple procedure that's done in the operating room. It takes about an hour under anesthesia, and the effects are noticed pretty much immediately after the patient is recovered from surgery. And I think that this is a great treatment option for men who have mild incontinence. Say you're walking around and most of the time you're dry, but you're at the gym, you're going on a run, and you have some leakage, you squirt here and there. These are the guys who do really well from the sling because they just need that extra boost.
I like that you're explaining it in this sense of showing us the diagram, that it's really just a matter of relieving pressure in certain areas, and that's where the solution comes from. Now, you've also got a device called the Boston Scientific AUS. What is that exactly?
Yeah. So AUS stands for artificial urinary sphincter. It's a prosthetic device, and it tries to replicate what our body does naturally. And so our urethra drains the bladder, and it comes through a web of muscles that are in the pelvis that kind of pinch off the urethra until you're ready to pee, and then they relax and let the urine out. And what happens after prostate cancer treatment is that these muscles can become weak and don't do their job anymore.
Right.
And so the sphincter is there to replace those muscles.
Okay.
And it has 3 parts. There's a cuff that sits around the urethra, and that acts like the substitute for the muscle. There's a balloon that goes underneath the muscles in your belly, your ab muscles, and that puts pressure on the cuff to keep you dry. And they're all controlled by a pump that gets tucked under the skin in your scrotum, and that's what the men interact with when they're using the device.
Right. Now, because we really want to give everybody the full picture of what to expect here, what are the side effects of both the sling and the AUS?
Sure. So I think I always try to be very upfront with people when talking about surgery. There's no way to skirt the issue that surgery does come with some discomfort afterwards. That's part of going through an operation. In general, most of that discomfort goes away by the first week. And then we worry about common things like bleeding and infection, which we control because these devices are coated in antibiotic solutions to help prevent infections from happening. Every device has the potential to stop working, and so I oftentimes will follow patients every year to make sure that things are still functioning appropriately.
Right.
If one part or another has given out, then we have the opportunity to replace it, and it's a much easier procedure. And then the really rare side effects are problems that come from sort of I think the infection is the primary one.
Yeah. Well, I really appreciate you being so upfront with us about all those side effects and options. Real quickly, how can folks find out more details about you?
Sure. I mean, the easiest way would be to call my office with questions. We have 4 locations over the Front Range, so 303-733-8848. There's great information on the website, fixincontinence.com, that has wonderful diagrams and videos, but I think most importantly, it has patients who've had the device talking about their experience, and they're very honest, the good, the bad, and the way that it's changed their life.
All right, Dr. Davenport, thank you so much. We appreciate all that info. Just go to fixincontinence.com to learn more about the products mentioned, or call Dr. Michael Davenport at Urology Associates. He and his team are here to help you with a variety of health issues related to prostate cancer treatment. Call 303-733-8848. This segment was paid for by Boston Scientific.